Nurses at Dora Nginza Hospital in eGqeberha have called off their unprotected strike, and for now, the Eastern Cape Health Department has committed to hiring more staff in the next 3 weeks. During the 2-day strike, nurses prevented doctors from helping pregnant women, leading to the death of an infant. Our reporter Siphosethu Booi has more.
The care of pregnant women, newborns and children took the back seat in eGqeberha this week. This as nurses at one of 2 maternal and pediatric facilities in the area went on an unprotected strike. Their grievances related to overcrowding and staff shortages at the Dora Nginza Hospital. Tragically, the action led to one baby losing its life. The National Education, Health and Allied Workers Union blames the provincial government for this. Nehal Provincial Deputy Secretary Sweetness Stokwe said this could have been avoided if the nurses' complaints were dealt with earlier.
What transpired here is that for a number of months there has been a lot of pressure to our members, whereby the hospital has been admitting more than it should. Dora Nginza has a 30-bed maternity ward.
She said although hospital management initially committed to stop admitting more patients than it could safely accommodate, it backtracked on the decision.
If you're going to admit more than 30 people as per the beds that are here, it means that what has transpired here, whereby you see people who are pregnant, who are in critical stages, having to give birth in the floor, having to give birth in the chairs, and other people had to be operated while they were on the floor. That is the bad situation that we have observed here. And our members were calling to say that it is inhumane what patients are being subjected to, and them as nurses have never been trained to operate anyone to give birth on the floor.
The strike was called off on Saturday when the Provincial Health Department promised to recruit more staff within the next 3 weeks. Stokwe said nurses were held responsible if patients are compromised, but they are treating more patients than they should be.
This is one of the things that has been draining the budget of the Department of the Eastern Cape, that they budget for being sued instead of making sure that they address the cause of these issues or these unfortunate incidents that are happening, where people are giving to stillborn children, people who give birth to people who are disabled. As you are saying that there's a child whose brain was affected, and all these unfortunate issues could have been avoided if the department would prioritize the issue of addressing shortage of staff.
The union says the department should give jobs to the unemployed graduate nurses. For Newzroom Afrika, Channel 405, I'm Siphosethu Booi, eGqeberha.